Hi, how you doing? This is Dr. Tom Iannello. I'm sitting here with Vanessa. Vanessa's been a patient for a number of months now, and she initially had come in with chronic headaches and low back problems. How long did you have the headaches that you had, Vanessa?
Quite some time. I'd say probably over a year at least.
Over a year. And in that time, what did you do to try to handle the headaches?
I took Tylenol. Sometimes I wouldn't take anything. I went to a neurologist. I was prescribed medications.
Okay.
I didn't like taking medication.
Right. And what did the neurologist say about the headaches as to what they were or what was causing them?
She didn't really tell me too much. She just
Okay.
put me on medication.
Okay.
She gave me a sample of medications and told me
Okay.
to try a few and tell me which one works best.
Okay.
And
And no results even with medication.
now, even with the Furus that I took now.
Okay. Which is a pretty heavy-duty medication.
Yes, exactly.
Then the other thing she complained about was this low back pain that caused her to limp. Now, it's tough enough to limp, but it's even tougher to limp when you want to run 26-mile marathons like Vanessa likes to run. So Vanessa's an avid runner, and she's been running for a number of years, and she would run through the pain. And it was funny because your partner at work noticed the limp,
Yeah.
and he's a patient of ours, and he says, you should go check out Dr. Iannello, we'll see what's going on. And she was very willing to come in, and she came in, and she had a hip misalignment. Her pelvis was misaligned.
Yep.
And it would cause one leg to be shorter than the other. And as a result, she's trying to run around, and she's running around on a crooked pelvis. So we began treating you. Now, how many years did your back bother you?
Oh, that was bothering me for probably a good 13 months before
13
I came
months.
in here. Yeah, I
13
was
months.
limping and the pain was just, it was horrible after a long run.
Sure. So Vanessa has been a very good patient. She came in, she did a program of correction. She's been very diligent with getting treated, and here we are a number of months later.
Yeah.
And when was the last time you had a headache?
It was before the new year.
All right, so we're talking like almost 4 months.
Yes, exactly.
Where you used to get them daily.
Yeah, I used to get them a couple of times a week.
And when you got them, they were, I remember you told me they would make you nauseous.
Yes.
And they would
It
give
would
you,
last for 3 days.
right, and you were literally knocked off your feet by those
Yeah, it
headaches.
was awful.
And then when was the last time you limped?
I can't even tell you.
That's the whole idea, is not to be able to remember those
I don't even remember.
Right, so obviously you've done very well.
Very
And
well.
you're very satisfied.
Very much so.
And was the program difficult to do?
No, you just come in here for 5 minutes and
See?
you're done.
Right, so
There's
great.
never a wait like at a normal doctor's office.
Thank you, appreciate that. So the point being is that sometimes things may seem like they can't be fixed, but they can be when you get the right proper treatment and you do what you're supposed to do. So Vanessa's just another great example of that. And again, I want to congratulate you
Thank
on
you.
a job very
No,
well
thank
done.
you,
Thank you
because I
very
owe it
much.
to you.
I am very, very appreciative. It's just great to hear that you're feeling so great.
So great.
So remember out there are things that can be fixed. You just have to get the proper care, and you can do the same thing too. Take care. Bye-bye.
Thank you.
You're welcome.